Hi, today we are starting a new talk on the series on healthcare communication skills. And today we will talk about the cultural gaps in the mm, healthcare, where a physician or a nurse working in an environment which is not coinciding with their own culture. For example, if Asian person is working in a Western world or an English speaking country or Arabic speaking country or an Arabic speaking doctor or a nurse working in a Western country where it's an English speaking country, and there are differences in the cultures, like there are differences in religion, the differences in the perception of care, the differences in the knowledge, differences in greetings even. So we cannot treat a patient without addressing these issues because he is not to convince, he will not trust until we make an harmony with their cultural backgrounds also. So now we are going to discuss in detail what are those cultural gaps where we can bridge these gaps and we are able to understand the psychology of the patient, and then we can treat the patient in the best possible manner in our circumstances. So now there are some beliefs of the patients in different cultures and different societies that this ailment which he is suffering or she is suffering from can be treated by some herbal things, by some spiritual methods, by some other methods which are non-scientific. So most of the time, what the physician do, he denies all these things. Uh, Sometimes they tell the bad language. In the bad language, they tell it is rubbish. It is non-existent. This is the 21st century, and we are living in a scientific world. We are treating the patient with the scientific-based medicine, evidence-based medicine. Okay, all these things are correct. You are on the right track, but don't deny it. Everything should not be declared. You have to come with the psychology of the patient. You have to listen to them, give them the scientific evidence, and give them your experience according to your knowledge. Respecting the customs will improve the compliance of the patient in your methods of treatment because beliefs influence the perception of illnesses. So you don't have to deny it. You have to change their minds. You have to change the minds of the patient towards the scientific based, evidence based medicine instead of denying it in making a patient a party or an opposite entirety. You have to make them in your team. In, you have to make the patient part of your team. You have to take the help from the patient. Instead, you should not argue unnecessarily with them. Okay, you answer the proper questions in a scientific method according to the understanding of the patient and their educational background. So, if the patient is saying something about the method of management which is non scientific, not evidence based, you don't have to deny it, just ask what they are trying to explain to you. You have to avoid slang language and the idioms. You have to identify each and everything very clearly coming to the educational status of the patient. You interpret all the things very wisely. And if you are not familiar with the language of the patient, either you're not from the English speaking background or Arabic speaking background or any other language barriers, you have to ask the help of the interpreters. but make sure your interpreter interprets only those things which you are trying to explain, not else otherwise, because it might cause confusion. So tell your interpreter to uh, to counsel the patient in the same way as you want them to be, instead of using their own wisdom and their own knowledge, because you are the responsible party for that patient. So address the patient directly if you can, with your own language or the language the patient speaks, if you know how to speak and how to interpret with the patient. And if you don't, you have to use a wise interpreter who can only explain those things which you are explaining in your language, and he is just an interpreter. So you have to speak, if you speak their own language, you speak slowly, give the pause in between the explanation. If in between the patient asks you some questions, don't obstruct it, don't deny it, just give the answer to the of that question and move forward. And first, you have to check the understanding and the educational background of the patient, instead of going for the medical jargons and very heavy language which the patient does not understand and becomes confused. You have to see what is the educational background of the patient, and you have to make use of the patient's attendance or a near relative, so that it will he or she will try to convince the patient according to your plan of management. But you have to respect their identity, their gender, their norms, their modesty, their cultural ethics, and even the greetings part of it. So please don't overstep by, for becoming the familiar with the patient, passing the cultural uh, red lines. So please work on the educational background of the patient, cultural background of the patient, with a solid evidence-based scientific knowledge, so that you can convince the patient in best possible way according to the patient's understanding and knowledge. If you can, if you cannot explain the patient by the verbal things or by the things which you are explaining, try to use the visual aids. Visual aids is not only the pictures, but you can make a diagram out of it. For example, if the patient has a fracture and you want to fix it, you make a diagram of the bone and tell the patient this is the bone, it has fractured, it has broken down, and you have to fix it in that manner by applying a rod, splint, and screws, or something else. If there is a gallbladder surgery, if there is abdominal surgery, if there is plastic surgery, you have to explain in your according to your subspecialty in the simplest possible way by making the diagrams. And you should repeat it slowly. Let the patient repeat your words, or let the patient repeat your ideas, and also summarize the key messages you want to convey to the patient. So, the take home message is that you should respect the culture of the patient, the language of the patient. Try to use the patient's own language in the best possible manner. It will make a better connection with the patient, because understanding precedes the treatment. First, you understand your patient, first, you understand his background, their culture, their educational status, and then you can treat the patient. Thank you. This is all for this talk. We'll meet you in the next talk. Thank you.